today for this session on cervical cancer awareness. First and foremost, to even begin with, I would like to thank Giri, the head of human resources, for initiating this really great, cervical cancer awareness session at the right time. Giri for having this initiation at the right time. And I would like to also introduce our guests for today. So we have Dr. Sai Lakshmi. She is a senior gynecological oncologist from Apollo Hospital. So she will take us through on details of cervical cancer preventive measures are available in the market currently to help you, take a better care of your health. And we also have Ram Chandar here, Managing Director of VGrow, who has actually supported us in organizing this event. A very warm welcome for you both. Thank you, Giri, for the honors. And yes, I also request you all guys to, let us all take up this opportunity to, get feeder with the information which is required on cervical cancer and also, take ourselves to the next level in our healthcare journey. So I hope this session would be very informative for you. Thank you.
I'm your guest and I'm here with Shiva and Ramgar itself. How many of you are frightened of being diagnosed with cancer? No? It's okay to get cancer? You don't mind? You have so much confidence in me, in us doctors. So is there anyone here who thinks it's okay, chalta hai, cancer ho gaya to kya hua, doctors will take care of me? Who is that person? Please stand up. I would really like to meet you. There's one person who put the hand up saying, okay, I trust the doctors. Can you guess how many cancers can happen? I know you're all thinking, Dasara time hai, what is this? We had a nice lovely lunch. This woman comes, talks about cancer. What's going on? So we won't talk about the bad things about cancer. We won't talk about good things about cancer. There's nothing good about cancer. But we're going to talk about something which will make a difference to your cancer, if you're going to get it, okay? So, can anyone guess in one human body how many different types of cancers can happen? Head to toe, if you count cancer of the mouth, eye, tongue, nose, eyebrow, nostril, everything, how many different types of cancers can a human person have? Not one person, but take a guess. What's wrong in guessing? You're pretty good. You're good. You should take biology, actually. More than 100, someone says. A better guess? A more nearer guess? 151. So far, we tabulated 151 cancers in a human body, of which there is only one which can be prevented and eradicated and made 0%. Of the 151, there is only one which can be eradicated completely. We can make it 0%. Can you guess what that is? I told you already you should come for biology. Cervical cancer. So for all the human cancers, there is only one which can be eliminated, prevented, removed from the table of cancers, and that is cervix cancer. And that is why we are here talking about cervix cancer. There's no point talking about a cancer to which there is minimal treatment or which is very dangerous, for which I can't pick up early. There's no point talking about it. The point is to talk about a cancer which can be prevented and made 0%. And guess one in how many women in India are getting that cancer? This cancer of the cervix, will come to what's the cancer of the cervix. How many women in India do you think get this cancer? Take a guess. What are you losing? 3 out of 5. Oh my God, where does the pessimism come from? 3 out of 5 people get cervical cancer. 1 point in 100. 1.5 out of 10. You have read my slides. Did you show my slides, even? 1 in 8 women get cancer of the cervix. 1 in 8 is a very big number. 1, 2, 3, 4, 8. 1, 2, 3, 4, 8. If I pick up people like this, amongst you, there'll be at least 20 people in your lifetime coming to me with a cancer in your cervix. It's that common. It's the killer cancer in India. So on one side, I'm saying you can make this cancer 0%. On the other side, I'm saying it is the killer cancer in India. Does it make sense? Why is a cancer which is preventable killing so many women? Doesn't make sense. And that is why we are here today trying to talk to you. The 2 killer cancers in India are breast and cervix. You know what breast is. I don't think breast needs an introduction. Every man, every woman knows what a breast is. We'll talk about cervix, but breast cancer, cervical cancer, they are my bread and butter. but there are also many people's death sentence. You have just eaten. My intention is not to make you nauseated and throw up, not at all. You people timed it with your lunch hour. I didn't. I could have come at 8 a.m. or 9 a.m. So don't blame me if you feel sick with these pictures, but this is reality. And cervix is a stick or a pen. I have a pen. Cervix is the bottom end of the uterus. So the cursor is where the cervix is. That is the lowermost part of a woman's uterus, and cancer of that part of the uterus is called cancer of the cervix, and it is the most common cancer which is killing women in India. And as an oncologist, if there is one thing I have to tell you, most of human cancers are associated with eating, sleeping, and having sex. If you think about it, that is basic to any human being and any animal and any living organism. What we all do commonly, you might be an IT professional, you might be a laborer on the road, you might be in Antarctica, you might be in Mexico, Belgium, wherever you are. We all eat, we all sleep, we all are sexually active. Majority of our illnesses are because of improper eating, improper sleeping, and improper sexual habits. I don't mean to comment on anybody's sexual habits, but if you think about it, men and women are supposed to have sex to reproduce, to conceive, to give birth to a child. Do you think that's the only time people have sex, or they have sex for pleasure? I don't need you to answer that. We all know the answer to that question. And this cancer of the cervix is happening due to sex. As simple as that. If you're a virgin, you won't get cancer of the cervix. If you have sex, you might get cancer of the cervix. So this cancer of the cervix is purely because of sexual activity. And what happens is, we humans are covered by skin. Yes or no? Skin has a virus called human papilloma virus, HPV. This HPV is there on you from head to toe. It lives under your skin, not on top of your skin. So this HPV is there under the skin in all of us. And if you look at different HPVs, I take a sample from your skin, from your scalp, from your nose, fingers, mouth, axilla, whatever, I will start seeing different types of HPV. So the HPV is of 120 types. So far we found out the HPV is of 120 types, and certain types, if they go into the woman's vagina, they can cause cancer. But they won't cause cancer then. Say she got the HPV 18, type 18 today, the type 18 will go under the skin and live under the skin 5 years, 10 years, 15 years, 20 years, any number of years later. That HPV 18 can make her have a cancer. So you understand the concept? Somebody's skin is going into that woman's vagina. Somebody's HPV is entering her, and that HPV will become a part of her body. If someone else enters her later, her HPV will go to that other person. So HPVs transfer between people, person to person. It's a sexually transmitted infection. But unfortunately, you won't know when you get it. There are no symptoms. And once it enters your body, it's your friend forever. It will never leave you until you die, because it lives under your skin. So as a human being, when I shake hands with somebody, I get their HPV if I'm really vigorous. If I kiss somebody, a deep kiss where the lips and tongue and everything is scratching each other, I will get some HPV. So HPV happens between people due to really intimate physical contact. If you just hug somebody, you won't get HPV. If I eat from the same plate, same spoon, I won't get HPV. But what causes HPV is deep kissing, sexual intercourse, or naked body-to-body contact. That makes people get HPV. Next, please. So unfortunately, the HPV can live under your skin forever. It never dies. If I get cold virus, my immunity will kill it. If I get COVID, my immunity killed it. COVID didn't kill me, my immunity killed my COVID. If I get HPV, the medicines will kill the HIV or hepatitis B or whatever. But if I get HPV, there is no medicine. My immunity will keep it under control. That's it. It can't kill the virus. So HPV has no death. Eventually, when HPV wants to die, it dies by binary fission. Biology, tell me, what's binary fission? Don't know. 8th class, 9th class, binary fission, atoms, amoeba. Binary fission is, you're talking binary fusion. I'm talking binary fission. Binary fission is one becomes two. They split. Yeah, it's too hot, isn't it? I should finish this talk soon. Binary fission is where one becomes two, two becomes four. You saw in Mahabharata, you put an arrow in one Rakshasa, they become two. Put two arrows, they become four. That's binary fission. So when HPV virus in you wants to die, it becomes two daughters. When they want to die, they become four daughters. So how on earth is this virus ever going to leave you? You get one, it becomes a million copies in you as time goes by. So HPV never dies. There is no treatment. But luckily, in the last 2 years, we have a vaccine for this virus. Very, very fortunately, we developed a vaccine for this virus. America developed the vaccine 17 years. I've been giving people this HPV vaccine for the past 17 years. But in India, we now have the vaccine for the last 2 years. And please don't stop touching people. Please don't stop walking like this. Don't start walking like this. Say, I don't want to kiss you, hug you, nothing, no more. I'm just a solo person. HPV doesn't go to each other so easily. You have to be really intimate with the person where there is some skin to skin rubbing. The skin has to get a little bit traumatized for the HPV to enter you. Many people, they come to me with genital warts, which is a HPV. Their excuse is I use public toilet. But trust me, HPVs do not survive on the toilet seat. They cannot live on plastic. So HPV you won't get by using a public toilet or by using a hotel towel or anything. If you get HPV, it means somebody's skin has closely rubbed with your skin. And almost everybody has HPV. We have it from head to toe. No point even checking if I have it on my fingers or my nails or my toes, I will have it. But if you have it in certain parts of your body and if you have a high risk type, then you might get cancer. So let's think about, the next picture is a bit gross. I feel bad for showing it to you after your lunch. But think, which parts of your body will receive another person's body part? You won't put your finger in somebody's mouth usually. You won't, would you? So if you think about it, what activity you do will make you get HPV? So kissing, hugging somebody naked, having sex, orally, vaginally, or anally. So these are the potential sites of, I didn't put cervix there because I already showed you the cervix. Mouth cancers, throat cancers, anal cancers, cancers of the penis, cancers of the vagina, cervix. These are due to head. Many people think tobacco, cigarette cause mouth cancers. Then why are so many women getting mouth cancers? Why are so many women getting throat cancers? It's not polite. Imagine you go to watch Devara and then there is a woman with a mouth ulcer saying, 20 years ago, my husband had oral sex. Now I sold my bangles and my house. You know, it doesn't sound right. Can you use the word sex in public and get away with it? So we as doctors know 50% of mouth cancers and throat cancers are actually due to oral sex. And it happens about 15 to 20 years after you have had oral sex. But we don't know how to tell people that this is what is causing it. And if I tell somebody oral sex can cause mouth cancer 20 years later, do you think that person will stop doing it? No. So instead, what we want to tell people is you do what you want in the safest way possible, but we have a vaccine to protect you. That's the whole point. So say you're worried now, I've been sexually active, I might have HPV. So what? So nothing. So many people have HPV, everybody has sex, people will have HPV. But this HPV will not cause cancer unless your immunity is on the lower side. So the key point is, if you haven't already been sexually active, take the vaccine, give your children the vaccine before they become sexually active, and keep your immune system on top of the game. Be healthy, be as healthy as possible, so even if you have HPVs, your immune system will take care of it. After such sessions, people come to me, doctor, please tell me if I have HPV. I want to know, I want to find out. What will you do after finding out? Cry every day? I don't know what people will do, but even if you want me to find out, there is no such test. Other than in the cervix, I can't check somebody's mouth and throat or anus and penis and say, yes, you have HPV or you don't have HPV. And even if the test says you don't, the next day it might show up. The test is not always accurate. So we don't test any for HPV. We only check for the disease. So what do we do? For those people, for children who have never been sexually active, please get them vaccinated. So when they become sexually active, when they get HPV, it won't cause cancer in them. Simple? Concept is simple, or any complications in this issue? Understood or no? Understood why we should give children the vaccine? Because your children, you will get them married, won't you? If you have children, you feel happy when people get married. You dress up nicely, go eat and all when people invite you for weddings. Because you want people to grow up, get married, have children and all. So it's very natural that your children will eventually become sexually active at some time point. And before they do that, give them the vaccine so they are safe when they are adults. For those of you who already are sexually active, who already might have HPV, we don't know, we can't find out. We advise a test called PAP test. I'm glad there are so many men out here, because these men, I'm sure, have a woman or two they love at home. Yes or no? A mother, a sister, a wife, a girlfriend, girlfriends, yeah? So please go spread the word that every woman who has ever had sex, she might get cervical cancer, and we have a test for them called PAP test. And what about mouth cancer? What about throat cancer? What about anal cancer? We don't yet have tests for these cancers, but pretty soon we will start checking for them as well. Talking about vaccine, both boys and girls should receive the vaccine, because the mouth and throat cancers can happen to either sex. The penis cancer will only happen to men. The cervix cancer will only happen to women. Then why are we focusing girls? Why are we not saying, why didn't President Modi last week say, vaccinate all the boys in the country? Answer this and I'll be super proud. Why are we focusing on girls? Why are we not focusing on men? Is it women empowerment, that women want to live longer, healthier? We don't care much about what happens to men? Is that the true reason? No, then why? Women have lower immunity. Come into competition with my immune levels. I'll show you how strong my immunity is. No, women don't have lower immunity, not at all. If anything, they have better immunity because they don't smoke and drink as much, yeah? No, it's not that. I'll give you a hint. Cervix cancer is far more common than cancer of the penis. Tell me why. Cancer of the cervix is way more common than cancer of the penis. Tell me why. It's a very easy guess. The penis is outside. If something is going wrong with it, an ulcer, a pain, or a skin change or something, you'll go running to the doctor, wouldn't you? Can a woman see her cervix, which is deep inside her body? After sessions, I've had people look into their vaginas, trying their best to look at the cervix with a mirror and really panicking. Please don't do that. You can't see your cervix. Because cervix is hidden, the cancer goes hidden for a long time. So the concept is cervical cancer is more common, so get the women vaccinated. In all developed countries where money is not an issue, where government gives free vaccines, it gives to both boys and girls. In India, free vaccination hasn't started. Parents have to purchase. So we are saying at least give it to your daughters because it's more common. If you have money, give it to both daughters and sons. Okay? So if you have money, give it to both your daughters and sons. There are two brands, an American brand which has been there for 17 years and an Indian brand which has been there for 2 years. They both protect you from cancer. Both the brands equally protect you from cancer. The American brand also protects you from skin warts. Skin warts can happen anywhere on your body, like near the neck you see small little brown spots. They are warts. You can get them on your genitals when they cause problems like itching. They can come in other body parts. So warts are also protected by the American vaccine. Cancer is equally protected by both. This slide is important for you to go home and decide which you want to give for the children at home, okay? The top one, the American one, is expensive. The Indian one is not quite so expensive. Next slide, please. That is the perfect age. Next slide, please. Again, small children, I expect they have no sexual exposure yet, so that is the age to target. What about if someone is older than 16? You can still give it to them, okay? But we give one extra dose. Next one, please. What if you're more than 26? You can still take it. We don't know if it'll work or not. Nothing wrong in taking it. But just because you took it, don't think you don't need the pap smear. You will still need the pap smear because this vaccine might not work for you. So what is a pap test? Pap test, I've been talking a lot about pap test because this one single test will actually really protect you from cancer. If there is one test you want to get done today, if there is one test you want your mother to get done today, come bring them for the pap test. It's a beautiful test. I'll tell you why. It takes 5 to 10 minutes. In Apollo, it costs 1500. It might cost 1400 somewhere else, but that's the average price. And next slide, please. So what does a pap test tell you? It gives you a guarantee period of 3 years. Can you name a product in India today which will give you a 3-year guarantee, a test or a product or something, your company, whatever? Can anyone give me 3-year guarantee, not a warranty, a guarantee for 3 years on a test or any object? iPhone 16, do you think it gives a 3-year guarantee? But this test does. If you get it done from a good center, say for example Apollo, I can vouch, I can write my house in return to say that for the next 3 years, if the test is normal, you will not get a cervical cancer. So the test comes with 3 possibilities. One, you're normal. You won't get a cancer for the next 3 years. 3-year guarantee period. Or it will say you actually have a cancer, your doctor could not see it and you don't know it. Please go to the doctor urgently. So the microscopic first stage cancers which I can't see and you can't feel, the test will show me. So many times on pap smear, we pick up early cancers, we treat them, we cure those women. Or it will say, you don't have a cancer, but you're not normal. You have a pre-cancer, so please go to the doctor, and where we remove the piece of the skin from the cervix and the pre-cancer is gone. So this is one of the best tests, the most beautiful test with a 3-year guarantee period, which will make sure that you will never get cervical cancer. In spite of knowing this, so many women, maybe 20, 25, come to Apollo every day with cervical cancer. Professors, IT professionals, housewives, MLAs. Why? When the awareness is there, why are these people still getting cervical cancer? Why don't people go for a simple pap test? Now, I'll ask you a question, answer me at the end of my session. If you people are left like this, I will see at least 10 cervical cancers from this cohort. Wake that girl up, please. And you're going to answer to me why. At the end of this session, you'll answer the question I'm going to ask you now. If I know post-lunch, even I feel like that. No problem. So if I did PAPS, if we left you guys like this, we might see 10 cervical cancers in this cohort. I mean men and women, relatives of the men and women here. If I took you all to any developed country, you would say London, UK, Melbourne, anywhere, it will be 0. And I want you to tell me at the end of the session why it will be 0 if you go there and why it will be so high if you're here. When should you get pap smear done? You should get it every 3 years from the first time you have had sexual intercourse. So normally we say marriage, post-marriage, every 3 years getting the pap smear. But if someone has premarital sex, then they should go back to when they started having sex and count 3 years from then. Many, many, many women, including 2 women in my clinic this morning, pap smear, no, never. So I do my consultation for PCOD or period problems or breast cancer or something, and then I say, do you want to get the pap smear? Why? I have no symptoms. Ne bane unnano. These are the common replies people give me, and if you're waiting for some symptom before you get pap smear, it's way too late. If you have symptoms, it means you already have a cancer. If you have a cancer, there's no point doing a pap test, then you have to undergo cancer treatment. So what are the symptoms? Symptoms are when you're even outside your periods, bleeding after sex, you're getting white discharge, there is blood in the discharge, which means there is a tumor on the cervix and that's what's bleeding all the time. So I'll stop my talk here. It's just too much of heat and discomfort. So I was just going to talk about PCOD and a couple of slides about cholesterol, because we are also worked up about cancer that we forget high cholesterol, heart attacks, strokes are also killing women every day. But now, let me know why, if you all went to London, say for a 6-month placement, you probably will not get cervical cancer. Absolutely, not for the vaccine. For those amongst you who are already sexually active, the vaccine will not help you. Without a pap smear, do you think you will get an entry into your job? Without a pap smear, do you think you'll get health insurance? Without a pap smear, do you think you'll ever be able to register with a family physician? So there it's mandatory. For $3, they'll do a pap smear. If you get a cervical cancer, they'll have to spend $30,000 on you. So without a pap smear, you can't enter any health system in any developed country. You will never get health insurance. While here, there's nothing like that. Yeah, the doctor feels like doing it, she'll do it. You say yes, she'll do it. You say no, she won't do it. As simple as that. So yeah, we'll stop it. So I'll take questions on HPV vaccine and on cervical cancer and on pap test. No questions basically mean the talk was excellent or the talk was utter rubbish. I would like to think so, but no. Like I said, I was in my normal self. Look, don't feel shy to feel shy about. Why will the vaccine not work if someone is of the older age group? Look, the vaccine will work if you never had any of those types of HPV. But there's no way of finding out. So what happens is, say a 30-year-old married woman with 2 children comes to me for a vaccine, I'll give it to her. But say she already has the HPV in her vagina, then the vaccine will not work in her vagina, yeah? But she'll go home thinking, I had the vaccine, so I'm safe. So we say women who have been sexually active, you take the vaccine if you want, but also get the pap smear in case the vaccine doesn't work. It's in case, we don't know, absolutely. But we don't want to give any fake reassurance that you had the vaccine so nothing will happen. Yeah, if it's a different type of cancer, yes. If it's a non-HPV type, blood cancer patient, can she take HPV vaccine? Absolutely, yeah. Look, when there is a cancer in the cervix, it's a tumor, it bleeds. So because it bleeds, this woman will be bleeding all the time, not just during her period. So a little bit of bleeding. Mouth cancer. Mouth cancer, you'll have an ulcer in your mouth. It'll be so sore, you can't swallow, you can't eat. When you open your mouth, you'll see white patches and a small ulcer. That is the beginning of a mouth cancer. Look, condoms don't protect from HPV because HPV goes from skin to skin and you can't have a no-touch sex. Yeah, that's not possible. So even if the penis has a condom on it, some part of his body will touch yours or her body will touch yours. So it's difficult to prevent HPV. They did a study in Delhi. You know, this was 8 years ago. They did a study in Delhi, and this was a very interesting study where they sent cotton buds, you know, the ear cleaning cotton buds. They sent them in an envelope to Maulana Azad Delhi University, to the female people, students, and they said, all of you just touch the cotton bud on your genitals, put it in the envelope and send it back. So no name, no age, nothing. They just had to rub it on the outside. Guess what percent had HPV on those swabs? This was to find out. First question was, have you ever had penetrative sex? Penetrative sex is where the person enters. Yes, no, do the swab, send it. What percent of people who said no to penetrative sex had the HPV? Can you guess? 79%. So this was when I was in UK at that time, and I was one of the research persons on that study to figure out at what age we should start doing the vaccination. We didn't know. We thought Indians don't have sex as early as Westerners do, so maybe we should put it back to 18 or something. And we figured out that you don't need to have penetrative sex. Just cuddling and hugging somebody naked in that part can make you have. So they said, no, stick to 9 to 12. That is the best age, before they leave 10th class. Intermediate, God knows what happens. That whole area is very dodgy. So we say before the child leaves 10th standard, before you think she's doing anything like that, get the vaccination. So you can't take protection. Even if you used condoms, it will go, just from skin to skin. I can't answer for Government of India. It was meant to come pre-COVID. It was ready pre-COVID, but COVID just threw everything off balance, and we didn't know how safe 2 vaccines, we needed to promote that. But the idea started about 8-9 years ago. It's a huge investment, yeah? Even now it's a private company, which then India bought and all these things.
We started an initiative to do this kind of social cause awareness, because the age from 9 to 26 years, the age group like. So generally, as we Indians like, so generally, parents will think about our marriage time from 25, 26 years, right? So what we initiated is like, actually we come from edutech background, like, so we also have a small software company, like people are working here. So past 2.5 decades I'm in that particular industry, like, so I had seen a number of cases like. So then we started an VGrow healthcare foundation. So we want to do some kind of services to this kind of, it is only awareness kind of process like. So I want to become a part, and I request you also to become a part. Like, see, generally what happened, like, one support really makes lot of contribution. Like, so you can also adopt some schools or some kind of individuals. Like, I'm not asking like a big contribution, like one individual contribution, like. So generally, if I come and ask you a contribution, like what benefit you may be looking out, like. So generally, you have a tax exemption kind of process, like. So if you really donate one vaccine to one particular individual, like, so that really helps one life, right? And you also get the exemption so that you can file for your ITs kind of stuff, like. So that is one part. And next is like even corporate connects also we have, and we are also promoting, and we are also doing this some kind of awareness, like for you, for your children, for your family members, anybody can come to a platform and you can get enrolled with us. And apart to that, like we may be looking other services, like because being an IT heads, and you have a lot of technology with you, like, so we may be looking such kind of services also, like to promote, to educate, to give awareness in the social media, and whatever the services is possible. So we may be looking those kind of help from your side, which will contribute to our subject, like. So this is a small initiative what we are thinking to go ahead into the market, like.
I just want to clarify, Ram Garu and Siva, I've known them for a long time doing a lot of charity work, etc. But I'm not associated with them. I'm just a guest speaker as a gynae oncologist. But I work on the same principle that when you can, you need to donate health. There's absolutely nothing like donating education and donating health. You can literally transform a person's life. And I work in Apollo, I'm a full-time employee there. I don't know if you guys got this hour as an off or you need to work extra. Off? Exempted? Or you're like me, I need to go back and catch up with my clinic now. And I'm running late. But all I want to say is, if you want to gift somebody a pap test, it will be 1,500 rupees. If you want to gift somebody a vaccine, it will be 2,000 rupees. And hand on heart, how many of you don't spend that kind of money on such absolute nonsense? I'm the first person to spend money on such nonsense. Buy clothes which I don't even wear once a year, but I buy them. Why? So do buy them, do go to spas, do eat out, do everything. But then also, when possible, please try and donate help. And this time I come out, I almost do one talk every 2 weeks minimum, or at least once a week. I take my own time out, and I do that because I dedicate my entire cancer raising awareness to two people. These two people broke my heart, and I feel I haven't mended since. And these were my first cases in the first month after I came back from UK. I was in UK for 18 years, nicely comfortable job, no money issues, not for me, for the patients, yeah. Government takes care of them. There is nobody pays in UK. Everybody gets free treatment by government. So money and poverty was never an issue. Then I come to India, I come to a corporate like Apollo, and this is what I face here. This woman, the top woman with a small child, Mehboob Nagar, some laborer, there they said, last stage, cervix cancer, go home. And this poor man thought if he brings her to a very big hospital, a corporate, we might do something. She was in stage 4. She becomes my patient because I'm a gynae oncologist. And I'm like, stage 4, what can we do? There's absolutely nothing I can do. And she stayed for 2 weeks for pain relief on the general ward. And one day she died because we knew she was going to die. There was a small child who the nurses used to feed and look after. The husband used to come and spend time with the baby. And the day she died, he never came. We had a dead mother, a small baby, the husband not answering the phone. We didn't know what happened. And everybody was like, write the death certificate, send the patient somewhere to postmortem, this, that. I'm like, what's happening here? And then 2 days later, somebody calls the nurse from the husband's phone. He ended up committing suicide on a railway track. And I'm like, cervical cancer, stage 4, the husband's committed suicide, the woman died, and then there's a small child. That just thing, and is it her fault that she got married and she had sex? That is the whole fault of hers. Why did she get cervical cancer? Because she got HPV. Why did she get HPV? Because she had sex. Is that a big fault? Is that worth dying for? But that's what happened. Who should have done a pap smear on her, on a laborer? The government should have done it. Why didn't they do it? I don't know. Why don't they do it? I don't know. But should we wait for government to come and take over our pap smears and wait till then? So you people, please don't wait for anybody. Get your pap smear done. And if possible, donate a pap smear to somebody. Bring your maid, bring your driver's wife, bring somebody with you who doesn't have this kind of awareness. The second one, she's an Anganwadi teacher, Nizamabad, same story. Comes to me with advanced cervical cancer. And then we start her on chemotherapy. She's beyond surgery, advanced stage. 2 to 3 months later, she passes away. And the sad story is the girl on the right, she adopted that girl. The girls on the left, she has twin daughters. The girl on the right is an orphan and she thought, okay, I have 2 daughters, I'll adopt another one. I'll have 3 daughters, I'll look after them. Then what happens? She gets cervical cancer and she passes away. And all I could do for those daughters, this was 6, 7 years ago, all I did was gave them each a cervical HPV vaccine and sent them home. And then you think there are so many women dying of cervical cancer. And my first few cases were these utter poverty cases. But then since I've seen some really ultra posh people who come in Audis and Mercedes-Benzes and Lexuses with cervical cancer. So basically people are not aware, or if they are aware, they are not bothered until it hits them. Please do not become a picture on my PowerPoint. Please do not become my cervical cancer patient. Prevent it, get the tests done, get the vaccines done, because I don't want to show your picture sometime later, a lovely IT professional look, kya ho gaya usko, okay?